Hi everyone, my name is Delanee Fullmer and my topic presentation is on what is the leading cause of death among Pakistani children and how could it be prevented. First of all, one thing to understand is what is under 5 mortality rate. The definition basically explains that every 1,000 newborns or births, it's the amount of children that will die before they reach the age of 5. So just some of the basic statistics. In Pakistan right now in 2017, 74.9 deaths per 1,000 were happening. And with it being a very densely populated country, we can kind of just see with these other statistics what that actually shows out to be. Like, for example, that 400,000 will die before they even reach 1 year old. And then, like pneumonia, it'll kill over 90,000 a year. And then right at birth, we're losing 46 brand new born babies at birth out of every 1,000 births. And some of the leading causes that have those deaths come into play is just things like the lack of oxygen, infections and pneumonia, and of course that access to health care. It's really hard in many of the rural areas. This chart here kind of shows us the numbers that we can see, what they expected and then what they observed. For example, in 1990, the deaths that actually happened under 5 and under were 111 per 1,000, and then under 1 year of age there were 80 dying. And now we can see in 2017, the latest record, it's down to 58 and 49. So things are dropping. But the main causes of death for children, if we look at this, it's the diseases like things like pneumonia, and these are the main factors. There are several others, but these are the top ones. Some other factors that attribute to these causes, or the cause of death, are of course poor sanitation, stagnant water. We know how that breeds mosquitoes, and they breed, and then we get malaria. Poverty is definitely a large factor in Pakistan. Contaminated drinking water, and then of course that brings on diarrhea. And once again, we're looking at access to health care is a factor again. This here is just some of the statistics that UNICEF gave in 2017, just so we can kind of see what's going on with the drinking water and how it can still be improved. And it just reminds us that there's a lot of people that they do have to walk quite a distance to make sure to get water that is something they should be drinking. Malnutrition, it seems to be something that's one of the higher things that's causing it. If we could get better nutrition, then they'd be able to fight a lot of this off. There was a study done by a Professor Azim Nawaz. They found out that malnutrition is higher in Pakistan than anywhere else in the world. And with that, there's different types, and they break it down and explain the different types of malnutrition here. And they said once a child gets it, it doesn't leave. It's something that just doesn't go away. It sticks with them. And we can see that there's things that lead into that, and those are just some of the examples of the family sizes and low income. And of course, breastfeeding. There's a lack of breastfeeding, and the mothers aren't breastfeeding there like they should be. And that would help with malnutrition at a very young age just to start. So they're not starting out with malnutrition, but they've got a better jump. These are the things that are basic things you can do that Pakistan could do to help prevent. Some of these things they have been implementing, and that's why the numbers are going down, especially with vaccines. They're trying to get that around and into the rural areas. They're trying to educate more than anything the mothers and the families that these things are important, and that there needs to be breastfeeding, and they need to be doing better with their water and better nutrition. And there are several doctors in Pakistan that believe if they would have more skilled and educated midwives in the rural areas, they'd be able to even bring these numbers down even lower and have more children that survive birth, and it'd be a better start. It's just a matter of educating the families and the mothers on this. These are my references and resources. If you have any questions about my presentation, please feel free to ask them and post them on the discussion board. Thank you.